Hello everyone. In today's video, let us discuss about the Medicare program, which is one of the most common and also a very important insurance program in the US healthcare system, since it is a government sponsored insurance program. Now, let us start by first understanding what is Medicare and what is the eligibility criteria to qualify for the Medicare program. Coming to what is Medicare. Medicare is a federal health insurance program. Federal means government. It is administered by CMS, which is Centers for Medicare and Medicaid Services. Now, the Centers for Medicare and Medicaid Services runs the CMS program, and it is also considered as the regulatory body for healthcare system in US. Again, as mentioned earlier, since this is a federal insurance program, it is funded by the federal government. That means through taxpayers' dollars. Now, coming back to the eligibility criteria, people 65 and older but should have paid Medicare taxes for 40 calendar quarters or 10 years while they worked. Below 64 years with certain qualifying disabilities. That is, those people who are receiving Social Security disability benefits. Also need to be a US citizen or a legal resident. Now, in order to get Medicare coverage, the first thing is that the person has to be a citizen of US or a legal resident. That means they should have lived in US for at least 5 years in a row. And people with ESRD, that means those people who are diagnosed with end-stage renal disease will also qualify for Medicare coverage. Now, there are some costs associated with the Medicare program, which include premium, deductibles, co-pays, and co-insurance. Now, the Medicare program is divided into four parts. Part A, Part B, Part C, and Part D. Now, each of these parts cover certain healthcare services. Now, coming to government-sponsored Medicare, it is made up of two parts, Part A and Part B. Now, these two programs are offered directly through the federal government. Part A and Part B, both of these put together are called as traditional Medicare or original Medicare. Now there is also Part C and Part D, which we will discuss later on in this video. Now let's start with Part A, which is a hospital insurance. So basically it covers inpatient services. That means when the patient is admitted in a hospital or a skilled nursing facility, in a hospice, and also if the patient is getting home health treatment, then all these services are covered through Part A. So it basically covers the room rent, meals, nursing care charges, supplies and equipment during the hospital stay, like injections, bandages, etc., as well as operating room charges. Now, coming to the costs associated with Part A. For those people who have paid Medicare taxes for 10 years, Medicare Part A is premium free. They don't have to pay any premium. But those who have not paid Medicare taxes, they will have to pay premium. Now, the other costs for Part A include deductibles and co-insurance. Now, coming to Medicare Part B, which is a medical insurance. It basically covers doctor's office visits, outpatient services, clinic visits, emergency room visits, ambulance services, preventive services, and durable medical equipment like rental charges for the wheelchair, etc. Now, if we talk about the costs associated with Part B, now this is not premium free. There is a premium of $170.10 for the year of 2022. And the other costs will include a deductible of $233. And after that, the patient will have to pay a 20% co-insurance. As you observed, even though a patient is having both Part A as well as Part B, it still does not provide complete medical coverage for the patient. Things like prescription coverage, dental coverage, vision coverage, and hearing coverage. Now let us look at Part C. Now, firstly, let us look at the eligibility criteria. Who can get Part C? Only those patients who are enrolled in both Part A as well as Part B, they are only eligible to enroll with Medicare Part C. Now, these Part C plans are also known as Medicare Advantage plans. These plans are offered by private insurance companies in accordance with Medicare guidelines. That means these plans are provided by private insurance companies in collaboration with Medicare. They cover everything under original Medicare, all of Part A and Part B benefits. That means hospital coverage as well as doctor office visit charges. Most of these plans include prescription coverage and also provide additional benefits like dental and vision coverage. So, Medicare Part C plans will include prescription coverage, and also they will provide additional benefits like dental and vision coverage. Now, coming to the costs associated with Part C. These plans, they may have a premium and they may not have a premium because Medicare pays these private insurance companies directly towards the coverage provided to the patient. Patients have to keep continuing to pay towards Part B premium. So even though these Advantage plans are zero premium, the patient still have to continue paying their Part B premium, which is $170.10. As per Medicare guidelines, these plans have to set an annual out-of-pocket limit. Now, As per Medicare guidelines, these private insurance companies have to set a annual out-of-pocket limit. That means the maximum amount a patient will pay out of his pocket in a benefit year. Now, the other costs for Part C include co-pays and co-insurance as well as deductible. Now coming to Medicare Part D, which is prescription coverage. These are again offered by private insurance companies through Medicare. As per Medicare guidelines, these plans must cover all the types of drugs that are normally used by Medicare beneficiaries. Every plan has a list of covered drugs known as a drug formulary. Basically, it is a list of drugs that will be covered under that prescription plan. Patients must go through the formulary and choose a plan in which the drugs used by them are covered. So while choosing a plan, the patients must make sure that whatever drugs they are using are covered under this particular plan. Now coming to the costs associated with Part D. Costs for Part D plan vary from plan to plan. These plans have a premium. So the average monthly premium is around $32.08 for the year of 2022. Now other costs for Part B include a copay, and how much uh, patients have to pay towards the copay depends upon the type of drugs that they are using and the type of plan that they have.